welcome to Vitalleo. I'm Dr. Ben Lerner. We're in this great series on patient management, and today we're going to cover maintenance care with maintenance care expert, Dr. Todd Osborne. Let's get started.
So in regards to maintenance or wellness practice or enhancement care practice, whatever the term that you want to use for that, I just want to discuss with you the benefits and the value of creating that culture in your practice of a lifetime wellness care type practice. One of the things that frustrates chiropractors today, and one of the things that they deal with, is running a pain practice. And a pain practice is short-term care, right? Pain's the last to show and the first to go. A pain practice is going to average six visits, or a PVA, a patient visit average of 6 visits. And so that creates roller coaster practices. That creates practices that have to produce a ton of new patients coming in. That's a practice that will have its ups and downs, all based on the amount of new patients that are able to be generated. And it creates a replacement practice, if you will. So it's a constant turnover, right? You get 20 new patients in this month and they're all gone. So you've got to get 20 new patients the next month to replace them. And that practice is very difficult to grow because it's constantly replacing, versus a practice that is concentrating on wellness, is concentrating on maintenance, if you want to call it that. I prefer in our office to call it enhancement care, because our goal and our vision is to continue enhancing people's health for their entire lifetime, not to just maintain where it's at, but to enhance that care and help them experience true wellness as they move throughout their lifetime for them and their families. So I spend a lot of time focusing on that in our practice, and obviously lecturing on how to grow your practice. And so you can grow it either way. And obviously we all need new patients, right? That's especially when you're first opening, you've got to generate the new patients. You've got to have that new patient coming into your practice on a regular basis. But over time, you should continue to grow that practice by keeping those new patients in your practice, by having that long-term care in your practice. Those patients that are staying on not just a year, but they're staying on for 2 years, 3 years, 5 years, a lifetime. And that's true practice growth in my mind, because that allows you to not have the generation of new patients determine what your month is going to look like every month. If you hit a bump in the road and for whatever reason you can't market, here recently we've had practices shut down or closed down, or certainly their marketing shut down because they weren't able to go do screenings, they weren't able to go do talks. And so if you have that stable maintenance practice and a referral-based practice that results from that, you can continue going and not have that big roller coaster, those big dips and dives, if something like that comes into play.
Hey, we'll be right back with the rest of this material. But as a reminder, check the description for links to our podcast, YouTube channel, upcoming webinars, and other ways to get our contact regularly. I want to share this quick story with you really briefly from a doctor who has worked with Vitalleo, and then we'll get right back to the content.
Big shout out to Dr. Jason, another doctor out there in Colorado, just doing phenomenal work. Dr. Jason is a cash practitioner for the most part. There's a little bit of Medicare and some personal injury thrown in there. But what's amazing about the work that he is doing is his patient visit average. How long he sees a patient before that average patient is discharged or leaves the clinic. And he is setting an all-time record with a PVA of 75. That means every new patient that comes in, on average, sticks around for 75 visits. Now, why does that excite me? Because those are patients who are not just getting the pain control and the pain relief, which we're famous for. Those are patients who are getting to a state of wellness and optimum health, and they're keeping that and not going backwards. Well done, Dr. Jason. It's a great stat for you for this year, and we're looking forward to that actually increasing even more as this year progresses. Keep up the great work.
If you have that stable maintenance practice and a referral-based practice that results from that, you can continue going and not have that big roller coaster, those big dips and dives if something like that comes into play. So the key to true practice growth is keeping the patients there. Now, part of that is just your concepts and understanding that there is something way beyond a pain practice. So if you're at that level, you're just running the pain practice, understand that's a concept change for you, because you're never going to have patients that are lifetime patients other than they're just coming back every time they hurt, right? So that's just like running to the medicine cabinet for the Advil or the Tylenol every time that they have a pain or an ache or a headache or whatever the case might be. But you want to create that culture, and that they want to come in no matter what their symptoms are. They want to come in, they want to be wellness type patients. They want to live the best of their potential for their health. And so that is a culture to create that. And we can talk a little bit more about that. But first, I just wanted to go through and share some statistics with you that can help open your mind up to this a little bit. And so, I look at practices, especially newer practices. They should be gaining a bare minimum of 20% growth a year, right? And so let's just look at that. If it's a new patient practice, if it's a replacement practice. So let's just say 20 new patients a month, and that's where you're at. So, and you can run your numbers any way you want with this, whether it's 10 new patients a month or you average 35 new patients a month. But if you're running a replacement practice and you want to grow 20% a year, in year 5, you would have to average 41 new patients to have grown 20% every year. And in year 10, you would have to average 103 new patients a month to have had that 20% growth every year for 10 years. And so I think you can kind of see the writing on the wall with that. There comes a point where, number one, you can only process so many new patients in a month. And number two, what marketing can you do to continually produce that type of level of new patients? And heaven forbid you go 20 years or 30 years into practice, you would have to be getting hundreds and upon hundreds of new patients a month. So that I tell you that just so you can understand that part of it. Now, let's look at 20% growth a year if you're running a maintenance, a wellness, and enhancement care type practice. So let's take that same 20 new patients. Let's say you convert 80% of them to their original care plan, and let's say that average is 24 visits. And so that's going to end up producing 384 patient visits a month, if that statistically stayed exactly the same on average. So 384, and so year after year after year, if you get 20 new patients a month and 24 visit care plans, you're converting 80% of those, then you're looking at 384 patient visits, whether you're in year 1, year 5, year 10. That's what it's going to produce if that's stable. Now, let's look at this and say conservatively, if you had a system that can conservatively train your patients educate your patients, help them to understand making the intelligent choice for their and their family's health. If you had a system that could do that, conservatively, 60% of those 20 new patients end up converting to maintenance. And let's just say it's an average of 1 to 2 visits a month is your maintenance or wellness plan for them. So 18 visits over the next year on that. And again, these are conservative numbers. But if we do that, you continue getting your 20 new patients. In year 3, that practice would be seeing 860 plus patient visits a month. In year 5, they're over 1,000 patient visits a month. And in year 10, they're north of 1,300 patient visits a month. So you can see very quickly how obviously getting the new patients in and keeping that level there, but this practice grows exponentially by keeping the patients in there, to keep those wellness and maintenance patients there. And so you can run the numbers and, obviously this is just a numbers game to calculate these out, but you can see very, very quickly how a practice that's only doing 300 or 400, 250 patient visits a month, if they would actually keep those patients on board, that this can be, they're up in the 2,000 patient visits a month range very, very quickly. And the key to that is that's a lower stress practice. That's a self-sustaining practice because you don't have to continually produce more and more and more and more new patients. In fact, this type of system will produce the new patients for you because this is going to be a referral-based practice. So not only do you not have the stress of going out to get new patients, your practice is growing itself on its own by keeping the patients in there and the referrals that come in for that. And the referrals that come in are going to be what? Patients that are looking for that lifetime wellness type care. So I would just encourage all of you, if you don't have a system that allows you to do this, it can take a ton of stress off of you, and then obviously it can really increase your productivity and your profitability moving forward in your practice. I hope this helps. Have an awesome and blessed day.
Hey, thanks for joining us today. As a reminder, we've got regular webinars that go into even more detail on this topic. Check the description for more ways to get our content and sign up. If you'd like more information about Vitalleo and how it might help your practice, you can always reach us at vitalleohealth.com. That's VITALLEO health.com. Bless you, and remember who you are.